As we know, a number of our residents still have their natural teeth, but we also have a significant number of residents that have dentures. They might have an upper or a lower denture, or they may have a partial plate. As staff at Ananda, it's really important we know how to care for our residents' teeth and dentures to support their nutrition and hydration and their social enjoyment as well. One of the guidelines that we have in place that we follow from the Australian Government is the Better Oral Health in Residential Care. Now there's copies of these guidelines at Hope Valley in the resource room and at Findon in their meeting resource room. I would really urge all of our clinical care and wellness and engagement staff to have the opportunity to go through these guidelines and just refresh how we care for our residents' teeth. Oral disease and conditions can have social impacts on quality of life, including comfort, eating, pain and appearance, and are related to denture state. Older adults need to eat and talk comfortably, to feel happy with their appearance, to stay pain-free, to maintain their self-esteem, and to maintain habits, standard of hygiene and care that they have had throughout their lives. And it's up to us as staff at Ananda to support our residents with this and to support them with the independence of caring for their oral health. So having a look at quality of life, poor oral health will significantly affect a resident's quality of life in many ways. It may cause bad breath, it may cause bleeding gums, tooth decay and tooth loss. It may cause issues with appearance, self-esteem and social interactions. It may cause issues with speech and swallowing. Also, the ability to eat, nutritional status, maintain their nutritional status and weight loss, pain and discomfort and change in behaviour. You imagine having ill-fitting dentures or having an ill-fitting plate, or maybe not even having dentures in and trying to bite this apple. We wouldn't be able to do it. So we need to be very careful when we're supporting our residents and maintaining their independence that we assist them put their dentures in to make sure that they're fitting properly and to make sure that they're clean and free from any debris so they can enjoy their apple and the nutritional foods at Ananda as well. Impacts on general health if we're not maintaining a resident's oral health can include aspiration pneumonia, it can include heart attack, can include a stroke or lowered immunity and poor diabetic control. And this happens when the defence barrier is broken because of poor oral health, when the bacteria in the dental plaque can enter airways and the bloodstream. This can cause infections of tissues far away from the mouth and may contribute to those health issues I spoke about previously. It's really important that we support our residents with better dental health. I've got a couple of photos that come in the guidelines. Now, being mindful, these may be quite graphic, but it's important that we are familiar with them. As you can see here, we've got photos and pictures of gum disease, of a sore tongue, of oral thrush, of gum disease and severe gum disease. And as graphic as they are, you can imagine the impact that would have on a resident and the ability for them to eat and drink, to socially engage, to improve their self-esteem. So we need to look out for causes of poor oral hygiene. For our residents that have their own teeth or their natural teeth, we need to support them by having toothpaste and having that readily available for every resident. And some residents like to have different choice with the sorts of toothpaste that they like. So this is the Colgate that we're using at the moment, but please also ask the residents about the choice of toothpaste they may like. It's important to have a really good toothbrush. Now, for a number of our residents, they are comfortable with having medium bristles, but there's a number of residents that only like to have soft bristled toothbrushes. This is really important so that it doesn't cause any bleeding or further ulceration or discomfort when teeth are being cleaned. Because if a resident is uncomfortable with their teeth being cleaned, it's going to become really difficult for us to support better oral health. So have a look at your toothbrush, engage with the resident and consult with them and their family just to make sure that we're promoting better oral health. For our residents that have dentures or partial plates, now I've got a set here. Now this is a training set, they don't actually belong to any residents. But as you can see, we've got an upper denture here that is lovely and clean. And we've also got a partial plate. So this is generally what they look like. And for us to maintain the integrity and the cleanliness of the dentures, it's really important that we clean them properly, that we make sure that we get rid of any debris that might be sitting around the tooth or the teeth, and that we clean them softly with a gentle or a soft toothbrush and with toothpaste, and that we make sure that we rinse them. Now it's important that we do this in between every meal, because the last thing that we want to do is to get debris caught in the upper part or the lower part of the dentures, depending on what type the resident has. And if there is debris in there, you can imagine that rubbing along the gum and causing some ulceration and some discomfort, some bleeding, or as we said earlier, potentially being a source of infection, which may have more sinister complications for the resident. Overnight, the residents may choose to have their dentures removed, and for us, we need to again clean them and make sure that we actually sterilise them overnight. Now we've got Sterident that's available, so make sure the dentures, the partial plate are cleaned, they've been rinsed, and then we can soak them overnight in the Sterident solution. In the morning, when we're getting the resident ready and supporting them ready for breakfast, we can ask the resident, would they like to have their dentures in? Please make sure that the dentures are rinsed from the Sterident and re-cleaned and ready for the resident to put in their mouth. Now, most of the residents can actually put the dentures in themselves. They may just need a little bit of assistance and a little bit of encouragement. We do have gloves, so when you're doing this, please make sure that you're wearing gloves and that you perform really good hand hygiene before doing this and also afterwards once you've removed the gloves. Other thing to be really important is when we're adding an adhesive to make sure that the dentures are fitting properly. Some of our residents choose to use the Sterident or the Polydent adhesive. Now it's not about putting huge amounts so that it sticks like cement. It's about putting enough of the solution, which is like toothpaste, or some of our residents do prefer a powder, just sprinkling that in here or pasting it in so that there's enough that when it's put in and it's fitting around the gum area, it actually fits properly and it's secure. So that the resident is not wobbling their dentures around in their mouth, which again, if it's wobbling, it can potentially cause some ulcerations and some discomfort for the resident. Always get the resident to give you a good smile once they've actually got their dentures in, and just check that there's no movement. The resident may actually choose to try and take them out or tell you if they're feeling uncomfortable. Just making sure that the dentures are rinsed and well cleaned after every meal to make sure that there's no leftover food particles that are sitting in the dentures. Overnight, soak them in a Sterident solution and then rinse them in the morning for the resident ready for the day. If you note that the dentures are moving quite a lot in the resident's mouth, it's really important that you report that to the registered nurse so that he or she can liaise with the family or next of kin about organising for a denture technician or a dental review, just to make sure that we've got the right fitting dentures for the resident. And after all, we all want to enjoy our apples.